city market is making it a priority to respond to mental health calls with the teams you see behind me. It created a clinician-led response team last year. WRTV's Rachael Wilkerson reports on the team now operating 24/7 in the heart of Indianapolis.
911, what's the address of the emergency?
When 911 operators receive a call for a mental health crisis in downtown Indianapolis, it can alert the city's clinician-led community response team. The team started responding 24/7 on January 1st to calls where the person isn't considered to be violent or armed.
So far, the neighbors that we have encountered have either been unhoused, have some type of substance abuse or mental health concern.
This started as a pilot program last year using federal dollars after faith leaders and community members pushed for a clinician-led mental health team that can respond to calls 24/7 versus the city's mobile crisis assistance team, which is part of IMPD.
We need this. The community needs this. What if there was someone that didn't have to carry a badge, they didn't have to carry handcuffs on them, just to bring resolution to a situation?
Now the program is part of the city-county budget and looking to expand to the east side. Director of Operations Andrea Brown says the goal is to make people in a mental health emergency feel comfortable.
We're educated and we know what we're doing and we know how to handle these calls. So I want the community to know that when they call 911 and request the clinician-led community response team, that you have professionals who are going to arrive and care and be compassionate and empathetic.
It is so important to ensure that we're able to provide the crisis intervention and the on-the-scene de-escalation that an individual might need during a mental health crisis.
The city says so far, teams have responded to more than 130 calls and are currently seeing an increase.
I have seen a lot of hurt, a lot of pain, people that feel misunderstood, people that are seeking validation.
As the need for help and resources ramp up, clinician Lee Ivy has this message.
I really want the communities at home to know that we're available, that they don't have to navigate these hard situations on their own, that there are people that would show up if they made the call, that would want to hear them out. We're not trying to put them in a jail. We're not trying to remove them from their children. The mission is to figure out what do they need so that they can be their best selves.
Rachael Wilkerson, WRTV.
Rachael also tells us that the clinicians have also moved from the basement of the city-county building in downtown Indianapolis to a new downtown location. That new space gives them a place to review all those situations after dealing with what they consider at times, quote, intense calls. And now at 6, we have more details on this story. So far, the city says the program has 22 licensed clinicians and 24 directors and program administrators. Each team must include a clinical supervisor, a licensed clinical social worker, and a peer specialist.